Ronan, who's going to talk to us about beyond mobility, who mixes with whom in metapopulations.
All right. Hi, everybody. My name is Ronan. I'm currently a PhD candidate at Georgetown University, and today I'll be talking about assumptions between mixing with residents and visitors and thinking about like a metapopulation framework. So I guess taking like a overarching look, like one of the primary goals of epidemic modeling is thinking about estimating contact behavior and specifically thinking about contacts that are relevant for disease transmission. So suppose we have an example of like a network of people in a small population where we know all the people in this population and their contacts, specifically their disease transmission relevant contacts. So if someone in this network gets infected, it's of course pretty easy to figure out who's at risk of secondary infection. So we can think of this as like a network model, and that sort of estimates this heterogeneous mixing. So the mixing is specific to the individual and the contacts that you have. Now on the other end of the spectrum, what was talked about earlier today, SAR compartmental modeling, where people move between susceptible, infected, and recovered states. One of the key assumptions here is homogeneous mixing between people that are in all of these states. So other end of the spectrum of from heterogeneous mixing to homogeneous mixing. And you could think maybe heterogeneous mixing is maybe more realistic. It's at an individual level, while homogeneous mixing is less realistic, but it's more tractable at the population level. And of course, each of these models maybe depends, the usefulness depends on the disease transmission mode. So maybe a network model is more interested for sexually transmitted infections, while thinking about homogeneous mixing is maybe more relevant for respiratory infections. So I think this presentation sort of explores, I guess, making homogeneous mixing maybe a little bit more realistic and like exploring this sort of like spectrum. So one of the most popular ways to like modify this homogeneous mixing assumption is thinking about age-based mixing. And this was made, I guess, more prominent with the availability of contact surveys. So for example, Polymod, which explored like contacts both within age groups and between age groups. So then if you're thinking about a compartmental model, you're able to sort of modify this homogeneous mixing assumption between two homogeneous mixing within age groups, but then heterogeneous mixing between age groups. So you can think of modifying this like assumption demographically, but then another popular way is by space. And this is referred to as a metapopulation model. So you have a network, but instead of individual, it's location. So it could be counties, regions, countries, and they're connected. Each of these subpopulations are connected by travel and mobility, but within each subpopulation, you're assuming homogeneous mixing. And this obviously became more popular with the availability of like large-scale mobility data. But then, of course, within each of these patches, you have your traditional compartmental like model where people move between disease states. But I guess my main question is there like a more realistic way to think about this type of social mixing in a metapopulation way? But before that, sort of thinking about why we care about this, and of course, it's for thinking about the spatial diffusion of disease. And I'll argue that it's dictated by two behaviors. So travel, someone moving from location J to location I, bringing an infection. And then, of course, just because someone travels doesn't mean they're going to transmit. You need to also have this mixing behavior. But currently in most like metapopulation frameworks, this like traveling and mixing is dictated solely by like the mobility information that's input into them. So if you're thinking about homogeneous mixing within a metapopulation patch, if residents choose to stay in that patch and visitors come, you're assuming these residents and visitors are just homogeneously mixing. But in reality, we know that that's not true. People are clustered based on like the built environment. So for example, we're all clustered together in this room. We're not just moving freely throughout all of Nottingham. And this is sort of, you can think of it as being, dictated by the built environment, where perhaps maybe you have hotels that are mostly made up of visitors, restaurants that are maybe more of a mixture of the two, and then maybe grocery stores where maybe it's mostly residents. So I feel like I want to this presentation is really exploring like this sort of idea of social mixing between residents and visitors. So what does resident-visitor mixing look like in reality? So thankfully, we have some data for that to explore it. So the main finding is that residents and visitors aren't evenly occupying public spaces. And so this data is from thinking about mobile phone applications and collecting data from, I don't know, thinking about Google Maps, or you don't actually know the exact applications, but they record your location and also if you're a resident or visitor. This map here shows New York City, so Manhattan, the primary borough, and each dot is what's called a point of interest. So think about like restaurant, grocery store, gym, any sort of like public space. And the dots are colored by the proportion of like people that are from Manhattan or not, or that are visiting Manhattan. So we see this as like a very spatially heterogeneous, where sort of in the middle of the island, it's much higher visitor proportion versus the north of the island is mostly residents are interacting. And we also see this is dictated by the spaces that people occupy. So grocery stores, fairly like intuitive, but grocery stores have a lower percent of visitors versus hotels have a much higher percentage of visitors. But then the question is like, how do these like data-driven assumptions of resident-visitor mixing compare to what we traditionally assume from mobility data? And we see that mobility data often underestimates visitor presence. So in this figure, we have two distributions. The orange is what's assumed for mobility. This is the like visitor percent at the county level in the US. And the blue is this data-driven mixing visitor percent. And we see that this blue distribution is shifted upward. So based on what we're seeing in the data, public spaces have like a higher percentage of visitors than what we're traditionally assuming. And this, we can also look at this spatially. So we see it's pretty consistent across United States counties that this like visitor proportion is much higher when we're thinking about this like data-driven public space mixing. But the main question is, does this impact disease dynamics? So what I did was I developed a metapopulation model where I'm incorporating both mixing behavior and mobility behavior. And then I essentially have a model that is like more what we're assuming just from mobility data, and then a model that incorporates this mixing and mobility data. And we see that it speeds up the spatial diffusion of disease, incorporating this mixing behavior, and also increases the synchronicity of epidemics. So this is a stochastic model where we're looking at the interquartile range of disease arrival times. And I just ran this for considering a theoretical disease outbreak that starts in New York City, and it's just for the state of New York. But we see that the blue, which is our data-driven mixing model, shows a faster diffusion of disease compared to the orange, which is what we assume for mobility. And then this is a similar figure, but looking at peak timing, and we see much more synchronous peaks when we're looking at this data-driven mixing compared to mobility assumed mixing. And just one final like aspect to think about is by like separating out these two behaviors that are relevant for disease spread, we can sort of think about resident-visitor mixing to inform public health policymaking. So both in terms of like mobility restrictions, so keeping people from traveling, but also you could maybe think of a different type of intervention of keeping people from mixing. So maybe restricting indoor spaces to only residents. And yeah, I tried to look at for some like relevant close by examples, but I think there were some localities in Wales that actually did like license screening to make sure that people that were entering grocery stores were only residents. So there is some, I guess, like real world examples of this being implemented. And so looking at these two like policies in tandem, I feel like yielded some interesting results. So this is looking at the proportion of counties that were infected at 6 months after disease introduction, where the x-axis is thinking about reductions in mixing between residents and visitors, and then the y-axis is reductions in mobility. So we see the first thing is that reductions in mixing alone is actually not improving the or limiting the spatial diffusion of disease. Whereas if you're reducing mobility, that's a much more better effect. But then the coupling of these two in tandem have like the largest overall effect. And then this plot here is just exploring these three diagonals where we see that even just limiting mobility and mixing by 50% in tandem isn't sufficient to reduce like a theoretical disease outbreak, but together reducing by 99% each is reduces or delays the spatial invasion by like 100+ days. So this is hopefully I convinced you that this resident-visitor mixing behavior is important to consider when examining infectious disease dynamics. I tried to break out this conclusion slide based on the discussion rooms that we were having. So thinking about the data, identified a fairly novel like mixing behavior based on this like mobile application data source. Thinking about the abstraction, I tried to aim to incorporate this behavior into a metapopulation framework. Thinking about the policy, examined the policy implications of this like in tandem and coupling of mobility and mixing interventions. And then I think the final piece of this, which is in progress, but I feel like probably the most important, is actually like validating the relevance of including this behavior. So what I'm currently working on is fitting these two types of models to the spatial diffusion of COVID in the United States and seeing if like including this mixing behavior improves our both thinking about maybe like estimates of like epidemic parameters of, and then also like, does it improve our like understanding of like the ordering of spatial diffusion at the county level? So with that, thank you.